we're going to follow that spine all the way down to the lumbar end where it comes together at the point for a normal spine or no spina bifida. So that looks beautiful and normal. This black circle is your baby's stomach, and here's your baby's bladder. The stomach means your child can swallow, and the bladder means the kidneys are working. So those are always safety checks. This is right where the umbilical cord comes into the baby's abdomen. Cord insertion always rules out abdominal masses and tumors. So when we can see the cord entering the body, it's because there's nothing blocking it. So that's always a safety check, so we like to see that. So the baby's able to swallow, kidneys work, and cord is inserting correctly. Okay, then we're just going to get a abdominal shot of the baby's belly and measure it. We measure the head, the stomach, and the thigh bone, and it gives me the weight and the date at the end. This is blood from the umbilical cord, stomach, and tailbone. So this circle, think of a tree trunk slice and then looking down on top of it, abdominal cross section. Just going to measure that. It converts millimeters into weeks and just does it automatically. And this comes out to be 21 weeks and 6 days, which is perfect. You should be 21 weeks, so that's beautiful. Okay, and then this is baby's leg, kind of all stretched out here, do you see, like a foot against the wall? See a leg and a foot right there? And then the other leg is coming right behind it. And then you have the feet right here. See, there's the bottom of a perfect little footprint. Measure me for shoes, please. And the other foot is right underneath here. So they look great. And then what we're going to measure is femur, thigh bone. Femur is the long bone of the body. If the femur bone is appropriate, all the bones will be normal. And that's from the hip socket down to the kneecap. Also 21 weeks, so beautiful long bone. So it rules out dwarfism, it rules out skeletal dysplasias. A soft marker for Down syndrome is short and long bone, so you just don't have that marker. And do you want me to tell you the gender for sure?
Yeah.
It is a boy. Boy. Is that what you thought?
Yeah.
Okay.
Yeah.
She's not saying anything, so I'm thinking she's maybe very shocked. No, it is a boy, for sure. This is a leg, this is a leg, this is penis. So definitely a boy. Congratulations. Okay, and then baby's like being a little hands shy, see up over the head, like, please, no pictures to my public, yeah. And the other arm is coming up right behind it there, see? There's an arm there too. Do you see the whole shoulder, coming up and a finger sticking out?
Oh, that's...
And then here's the other hand with the knuckle sandwich here. And then this is baby's kind of little face looking out at the camera. They look like little baby Halloween. You see, like eye socket, eye socket. They don't have any appreciable body fat yet, so they don't look like Gerber baby till the next time. This is the top of your child's head. The white line is where the skull is fused. These little black half moons are ventricles called thalami. This part of the brain is the cerebellum. I just have to change my film real quick. It just beeps at me and tells me I'm on a film, so I just need to reload for a moment. So baby's looking very healthy. Alrighty, and then we're going to measure the baby's head, just like we did on the abdomen. This is called biparietal diameter, and this is across the top of the baby's head. And that comes out 21 weeks and 4 days. And then we measure around the head. It takes 2 for the head measurement. And that one comes out to be 21 and 2. So beautiful. So the whole baby's very consistent growth at 21 weeks, and that's good. That's what we want to see. And then we're just going to go back down here and see baby's just kind of laying backwards. Do you see like the arm up over the head now, like sideways? See like laying on the back? Yep. See, here's the heart beating. Baby's putting the hand in the mouth.
Oh, really?
Yeah, the mouth just opened.
Sucking.
It was sucking on its thumb for a minute. It just put it out of there, and now it's just rubbing the little face right there. Like, no, I can't see. I think I see your mouth moving, pumpkin. I think you are sucking on that thumb. See the little nose right there? See? Here's the cute little nose.
Oh, yeah.
And then that's the hand right in the mouth. Is there no privacy in my world? This is your baby's beautiful 4-chamber heart. Do you see the cross right there? And we're going to get, your baby's just putting an arm up in the way. There we go. And so this divides the heart right to left, interventricular septum, and then you have mitral and tricuspid valve. The two on the top are the ventricles, and these are the atriums. A 4-chamber heart rules out about 70% of cardiac anomalies. So we love to see a nice 4-chamber like that. That's beautiful. And then we will listen to it. We're just going to put the Doppler on and get some sound going. Just going to push the sound up. And we're going to move that, see the legs in the way, there we go. Nice and fast and steady like a little galloping horse. Get all different sounds depending on what is trying to mess with my sound waves, like the arm, the leg. I'll get enough in a row and then I'll play. That's baby moving. There we go. Enough in a row that are the same. And then I can tell you, there's no arrhythmia, it's just a wild child. Heart rates are, average fetal heart rates are 120 to 160. And your child is at 143, just right in the middle. So beautiful. Don't like over 200 or under 90. They're pretty extreme if they are not good. So that's important. And this is baby boy parts again, sticking out here for the whole world to see. Because he's not going to wear pink. He wants to make sure of that. This is the umbilical cord that's all around behind the baby. It looks like a little chain effect. And we're just going to get a cross-sectional view where I can show you that there's one vein and two arteries. And so we're going to get that angle here in a minute. And what that is there's a skinny black river and a skinny black river and the fat one in the middle. That's an artery, and a vein. And that's exactly what you want to have. It's a true vessel. This is your nice healthy placenta, which is on the bottom of your uterus, which is a good place for it. And it should look just like a pillow of snow. We don't like to see it look like baseballs or Swiss cheese, so that's completely normal. And that looks good. So the black is the fluid, placenta, and cord. That's all your support systems, and they all look fine. Good. Baby looks very normal. Nice and active, healthy. This little structure here kind of looks like a little candy cane a little bit right there. That's the aortic arch, or the outflow tract of the cardiac system. That's the actual normal way that the blood leaves the heart, is on that angle. Good. He's beautiful. We're just going to check kidneys, make sure baby has both kidneys, and then we're good. Baby is lounging like in a hammock, as you can see. How I normally see kidneys is when they turn over and kind of put their butt up in the air. So we're going to shoot through the belly to get to the kidneys, and we'll go this way. Kidneys are kind of subtle, hard to see, gray on gray. They're soft tissue sitting on top of soft tissue. The only time they show up well is if something's wrong with them, then they get dilated. And there's always, sometimes you'll catch some fluid going through the kidneys because it filters. Kidneys are filtering before everything gets to the bladder. And your baby's just very wiggly, which is a good sign, but not when you're chasing down some hard-to-see kidneys. So we're just going to wait for a moment until baby is like a little worn out maybe, or turns over, and then I'll get them for you. But it's just the leg is going up in the air, and that throws shadows over the view that I'm trying to get for the kidneys. Ultrasound is extraordinarily angle dependent. There we go. Do you see the tailbone here? And do you see a little deeper circle here? And just a little deeper circle here? Those are perfect little kidneys. They have like a white rim on them right here. The only time, like I said, they show up well is if something's wrong with them, they'll turn black. So those are perfect kidneys. And then we know they work because your child has a full bladder, which is what should be black, which is the bladder, which is right there. That's good. It's called a renal safety check. He looks beautiful. Congratulations. Very animated, very busy. Life is good. Baby's yawning. See the mouth closed. Do you see? Just close it. Say, well, when you're young, everybody's mouth looks rather large. And then these are those legs that are kind of like frog legs. See?
Where's the
Keeping them together. The head